Hi everybody, Dr. Peralta here. Today we're going to be talking about the skeletal system and how this pertains also by the x-rays. That way you know bones and x-rays. First of all, the normal anatomy, if you look at the picture of Leonardo da Vinci, is like this with your hands open, facing you like this, okay? So facing you. So anything this way is anterior to posterior. Anything like this is lateral, okay? So these are the bones. I'll start from the bottom here. This is your foot and your ankle. The foot and the ankle has three views on x-rays. A to P, anterior to posterior, lateral, sideways, and oblique. When I mean oblique, anything that has a 45-degree angle. Instead of being here, we do 45. So your ankle and your foot are going to have three views. Next to that we have, this is called a long bone. Why? Because it's long bone. There you have it. The big bone, also known as the shin bone, also known as the tibia. There you have it. Tibia is in the midline of the body. Okay? And the fibula is on the outside. So this is medial and it will be lateral to the midline of the body. That's another one. Next we go over here. So we have our joint here, or the kneecap. Between the kneecap we have a menisci or meniscus, which is cartilage that helps us move, flexion and extension. This is also called the patella, the kneecap. And when we have the knee, usually we have two x-rays, A to P, anterior to posterior and lateral. Okay. Next here we have a long bone. This is called the femur. This is the longest bone of the body. And we usually, if needed, we take x-rays, A to P and lateral, two views. Then we move to the hip joint. The hip joint is this. This is your long bone or the shaft. Then we come here with the neck. And there's a talon here, and this is called the head. And the hip usually has two views. The front view, A to P, and then we have one known as the frog leg, which pretty much you bend the knee like that, okay? So now you have the foot, ankle, the long bones, and this right here is the pelvis. Okay, down here we have, this is called the ischial tuberosity. This is where we sit. And every time you sit and when you're behind, you make contact with your ischial, or I should say right here, ischial tuberosity, or also known as the ischial tubes. And here we have the pelvic bones. This is known as the inferior ramus, superior ramus. Ramus is Latin for branch, rama, and this middle one is symphysis pubis. And this is the hip, one hip, or the alar of one hip, okay? This is the birth canal for women. That's where the baby travels. And on the hips, we usually take mostly A to P. And usually we want the feet a little bit inverted, like this. Next to that, we have the lumbar. And that one we should A to P and lateral. We got lumbar is 5 vertebrae. And thoracic or mid-back, it's 12 vertebrae. And that was A to P and lateral. The thoracic, all the ribs attached to the thoracic, okay? When I mean all, 10, because if you look here, I'm gonna turn this around, number 12 and number 11, they are not attached to the breastbone, also known as the sternum. So these are called floating ribs. They're just floating there. What is the purpose? Not yet to give you that answer. I don't know. But I'll ask God one day. One thing, one landmark, or one pearl, that whenever you take x-rays, this last rib is going to be short, and that's the clue to tell you, for the most part, that you're dealing with T12. Okay? So that's T12 or thoracic 12, and that will make that 11. And the rest of them are ribs that do attach to the sternum. This yellow part, actually it's cartilage. So the rib comes in, turns into cartilage, and then the cartilage attaches to this bone, which is called the sternum. And the sternum has this little V-shaped, little tiny bone, also known as the xiphoid process. This is also a floating little bone. Can get injured very easy because it's not attached. Okay? So, and then here we have all the ribs that and protect our internal organs. Mostly would be liver is at the bottom, but with lungs and the heart. Yes, lungs and the heart, because liver is at the bottom. Okay. One landmark here for whenever you take X-rays, this rib, which is rib number 1, you're going to see that rib number 1 on X-rays like this, facing you, and you will see like a little tiny semicircle, which is this one. It looks really nice, so that's another landmark of your number 1 or thoracic 1 vertebra. Okay. To the sternum, you have attachment of the clavicle. This is your clavicle attaches to here. And so this joint is called the sternum clavicle. Sternum clavicle joint. Then the clavicle comes over, attaches to the acromion of the scapula, and also known as the AC joint. Okay? Next, we're going to move up here. Remember, this is the anatomy right there, anterior to posterior. You have the hand and the wrist have 3 views. Guess what they are? A to P, lateral, and oblique. You got it. Good job. Then we jump here to the long bones. These are the radiobone. The radiobone is attached to the thumb. One way to remember radiobone. You young guys probably don't remember because you don't have the old radio. But back in the days, at my age, we have a radio with a knob, and you would turn the knob, you find the radio station, or you would turn the volume. Some trucks do have now the volume, but back then, if you want to listen to a radio, which none of you should do, but you turn the radio and you go, and then you hear your station, that's where you stop. Anyways, radio, the thumb, you turn the radio, there you have it. And this is all your ulna, okay? These are long bones, A to P lateral. The elbow has 3 views, that's another one has 3 views, okay? So, elbow, wrist, and hand, 3 views, A to P lateral and oblique, you got it. And this is called your humerus, or funny bone sometimes. The reason it's called the funny bone because down here, this is called the olecranon process. We got a nerve that comes down here. Whenever you bump your elbow to something, it hits that nerve. For some reason, produces humor. So therefore, they call it funny bone or humerus for humor. Who invented that? I have no idea. Okay, next we go up here to the shoulder. Okay, the shoulder joint, and we're gonna get 2 views. Those views, contrary to A to P, oblique, and lateral, are just external, which means outside, and internal. So this is why when you take X-rays, you're gonna go, do your hand like this, sir, external, internal, and you get 2 views of that. Some other views that you may ask for the scapula, and then you can get the scapula too, okay? You want the clavicle, you get a shot too. And eventually, and then you can get skull. We're not going to talk about that. Very important. Now we're going to move to the cervical. The cervical has 7 vertebrae, which are back here. 7 little bones. Number 1 bone, also known as C1, aka atlas. They call it atlas because vertebra number 1 is holding the big skull right there, like this. Little like this, and then you got your big head over here. And they call it atlas. And if you look at atlas itself, is holding the world. That's why they call it atlas or C1, okay? When taking X-rays, very important, we get vertebra number 2, which is called axis. Axis is we must get that X-ray because if we miss it and there is a breakage in C2, also known as axis, it's on the breaks that is very, 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 very dangerous, can render people quadriplegic or paralyzed from here down. So very important to take A to P open mouth is one X-ray that you're going to get. Open the mouth. We shoot the X-ray with the open mouth, and then we can get that little, it's called dents. And in the next video, I guess I'll teach you the dents. and then we get lower oblique, and then with lateral oblique. Okay? I'm not going to go into fascia nor skull, but I think that's that. I hope I'm not missing anything. This is the posterior part. Very important when taking x-rays that you get the proper structure that you've been asked for and all the levels that you're asking. Hopefully this video helps you. Let me know. Any comments? Study. Let's rock and roll. Peralta Chiropractic. Thank you.